This morning, Brian Thompson, the CEO of United Health, was fatally shot outside of a Midtown Manhattan hotel. There are two things that usually occur after an incident like this, and the first being questions. It's most likely that United and the media learned of this news around the same time. So the media is gathering information, asking questions of bystanders, and will most likely start asking questions of Mr. Thompson's family, friends, associates, and will then conduct an internal investigation to try to get a sense of why this took place. Meanwhile, the company will start asking questions to help inform and prepare. They're going to have to work internally on a statement with their PR and communications team. They're going to have to work with the board and directors, other executives. And of course, they're going to have to find someone to serve as interim CEO. The second thing that takes place is public response. And public response can vary. Sometimes we'll see an outpouring amount of love and support, remembering that individual for everything they've done for their community. The second can and often takes place in the form of criticism. In my line of work as a publicist, I notice that oftentimes happens when we have an ethical client or an ethical brand. Unethical clients can be controversial. They often have a bad history with the people, with the media due to bad relationships, either romantic or professional. They also have a history of maybe using manipulative messaging, advertising. Now, this is not to say that the CEO has been unethical, because I have not worked with United. They have not been a client of mine. They have not been a business partner. But I do want to talk about the second thing because the public response is really painting a clear picture for how people are viewing the healthcare industry and also highlighting their experience with the healthcare industry. Across X, for example, I just saw this. Someone had said, my only question is, did the CEO pass away quickly or over several months, waiting to find out if his insurance will cover it? I also saw sending prior authorization, denied claims, collections, and prayers to his family. There is a lot that United will have to do over the next 24 hours, but healthcare companies should be watching and conducting social listening, going on social media, going into forums, and taking into account what people are commenting, um, reading these stories, sharing it internally. And especially if you work in PR, it's critical at this time. I will be watching how things play out over the next 24 hours and beyond. And if you are in the industry, I suggest you do too.